I'm Imane, and I welcome you to my podcast, Coffee with Me, Leaders of Change. It's been a while, and I'm so excited to be back. With me today is a leader whose innovative work is shaping the future of surgery, blending healthcare with advanced technology. We've met 2 years ago when we were discussing the HoloLens program. And since then, I've been following you on social media, and you are a true inspiration to everyone.
I wasn't quite sure what I was going to do in the future when I grew up when I was young. I had a lot of thoughts about becoming an engineer or join the military. At one point in time, I wanted to be a bus driver or a taxi driver. I guess the intersection between technology and medicine started when I was still a trainee. It started essentially with an AI project to look at big data to try and predict how patients will progress. I think this was almost 10 years ago.
Wow.
When we first started using machine learning and AI to churn and process some of the large databases that we have.
How do you feel technology helped healthcare, but also helped you in supporting your patients and better serving your patients?
I think it's sort of expanded the horizons and expanded the whole field of medicine into looking at ways and methods of looking at data and treating our patients, delivering healthcare. Things that we never thought were possible have become something that everyone is working towards. So for example, using mixed reality in surgical planning, in surgical guidance, image guidance, even patient counseling. These were things that as a trainee, I hope that one day we will have. There was one time we were doing quite a complicated case, and during the surgery itself, I was trying to recall what the scans looked like. We had to go to the computer to look at the scans again. And I remember thinking to myself, if only I had like a hologram in front of me to tell me exactly where everything is. And 5 years down the road, it's a reality. We can put on the HoloLens 2 and you have like this entire panel of 3D holographic images.
You are now training younger doctors, and you are now, guiding them into embracing technology and leading in the technology developments. What traits do you see for the younger trainers in training doctors while embracing technology and becoming better leaders?
One important trait will be that they are comfortable knowing that there are a lot of unknown out there, especially when we start venturing beyond our clinical training, our medical background and our medical foundation into fields that we are not entirely comfortable with. But at the same time, we are keen to try. Because if you don't try, then you never know what's going to work, what's going to not work.
I'm sure that you are an inspiration to many of them. And you continue to inspire them moving forward. The more you talk, the more I see a lifelong learner. I want to hear more about outside of Singapore, how you continue your learnings around the globe.
Having that perspective beyond Singapore allows me to draw on the experiences of a lot more people around the world. And it's very interesting to hear what are the things that work in their system, what are the things that perhaps may not work so well, some of the things that perhaps they wish that they would change. And then after that, coming back and say, okay, how can we learn from this?
If you go back in time,
Right.
20 years, 30 years, what would you tell your younger self?
Honestly, I would tell my younger self, don't change anything.
Live with no regrets. Thank you so much,
Thank you.
Dr. Gao.
No
I really enjoyed the conversation, and please continue inspiring us.
Thank you, man.